And maybe my next question to Dr. Griffiths and Dr. Mack, who are Canadian representatives on the COVID IBD task force, the Crohn's and Colitis COVID-19 task force. Anne and Dave, based on your experience of children with IBD, I mean, firstly, have you seen any cases of COVID-19 in any of your patients? And in either case, how do you feel that the children are doing when they get COVID-19 based on our knowledge of the secure IBD registry and other factors?
So as far as we know, none of the children or teenagers that we follow at SickKids have tested positive for the coronavirus yet or had the COVID-19 illness. None at all, as far as we know. And it's certainly, as everyone has said tonight, it's reassuring that around the world, when any children or teenagers acquire the virus, it seems to be a mild illness. And that is holding true so far, as you mentioned, from the secure IBD registry for children with IBD. So we generally would feel, for example, that a teenager whose Crohn's disease is very well controlled through the use of an anti-TNF drug is probably not at any more risk than one of his teenage peers. I think there are some things we still don't know about these observations in children, and talking now about children in general rather than specifically with IBD. But I think we don't know whether they just don't acquire the virus at all, or whether they truly do acquire it as often, but have more asymptomatic disease so that we're not aware that they are positive. I guess that will become clearer with more testing, but I don't know. Dr. Allen, what are your thoughts on that? Do you think the low rates are perhaps unrecognized asymptomatic occurrence, or just not acquiring it? Yeah.
Yeah, that's a great question. If you'd asked me about a month ago, maybe 6 weeks ago, I would have said it's likely that they're being infected, but they're not being symptomatic, and most of them are remaining asymptomatic. But there are now some newer data that might even suggest that perhaps they are not being infected as often as we think. Not yet, 100% sure about that, but there are some signals that require further research to clarify that.
So in Ottawa, I don't know of any of our kids that have got COVID. In talking with the parents and kids, the vast majority are following the public health advice of distancing, and I think that has a lot to do with it. I also think in our discussion Tuesday that was pretty in-depth. Overall, as it relates to the drugs, it's pretty optimistic. And I think more of our concerns really revolved around the kids that were sick. So rather than necessarily the drug, it might be the prednisone is just because those are in the sickest patients. And so really, we came to the conclusion that, it's in those sick kids or the flare kids, talk to the doc that's taking care of your child, because, when they can relax and do it. But overall, it was relatively optimistic. And one thing Eric and Anne brought forth was the European experience in the pediatric with this. And I don't know if you have that information on hand, Eric, that you wanted to share with the webinar.
So sorry, you mean the pediatric experience regarding the secure IBD?
From the Porto group.
Yeah, so it's getting a little bit older now. Maybe, Anne, you can update. I don't know if anything new has come out, but there were 8 cases that were reported a few weeks ago now and were published, and essentially all did well. But I'm sure there have been more cases reported now. And Anne, are you aware of more, or maybe Ed?
I think what Dave was referring to really was just the fact that the European pediatric gastroenterologists and the Israeli pediatric gastroenterologists, when they've had the same discussions as we've been having and when they've reviewed the data, their conclusions and their recommendations have been exactly what we've been saying here tonight. And I think a part of it is because based on the observations, the children with well-controlled IBD on biologics don't seem to be having a worse illness. And also the fact that we all recognize how important it is for kids to be with their peers and going through the same maturation and experiences at school and in university as other people. So not keeping them away from that if there isn't good evidence that it's necessary.